Starting off, as we usually do, with the COVID-19 situation here in South Korea. The third wave of the virus reached a new high in the country today, with close to 1,100 cases. Cluster infections are popping up at religious facilities and nursing homes for the elderly. For more, let's connect to our Choi Jeong-yoon. Jeong-yoon, walk us through the situation today.
Mark, South Korea reported 1,078 new COVID-19 cases on Wednesday. This is the highest daily figure of the outbreak so far. It's also the second time the country has surpassed the 1,000 mark, all in less than 5 days after recording some 1,030 cases on Sunday. With an average of some 860 cases over the past 7 days, recent figures have reached the threshold for level 3 social distancing, which is an average of 800 to over 1,000 daily cases, or if the number doubles dramatically. Even though calls to implement the strongest antivirus measures are growing, authorities are rather cautious considering the massive social and economic impact it would have. Health authorities rather called for citizens' active cooperation so that further spread can be halted under distancing level 2.5.
As distancing level 3 is the strongest and the last resort that would cause wide range of damages to small business owners, the government is taking an expert's opinion and reviewing over gradual increase in distancing measures.
Of today's caseload, 1,054 were local transmissions and 24 came from overseas. Cluster infections have been found at religious facilities as well as nursing homes across the country. Health authorities are suing some churchgoers in Chungcheongbuk-do province who held gatherings against restrictions. The country also saw 12 additional deaths, the second day in a row that deaths have been in the double digits. That takes the total deaths to 612. With the surge in cases, the Seoul city government will have all workers who are working in close contact with others to get preemptive tests. That includes delivery workers and people working in call centers, nursing homes, and public transport. Health authorities are also focusing on securing as many as 10,000 sick beds. Already almost 900 extra sick beds in living treatment centers and some 20 intensive care units for critically ill patients have been secured. The government has specifically separated standards for sick beds for better monitoring and is actively seeking cooperation with private hospitals to secure more beds. Back to you, Mark.